The new is with Camina that for the intermediate risk group population, we need an individualized therapeutic approach.
Euro Auditorium 2 was packed with attendees eager to listen to the debate on one of this year's hot topics. The session, entitled Cytoreductive Nephrectomy, Does Camina Change Everything?, brought together two experts to discuss the findings of the trial. Marqués, you've just come out of the session that you were moderating. Tell us very quickly, for anyone that doesn't know, what the Camina trial actually is.
We had a lot of data from retrospective trials that demonstrated that patients with simultaneous metastatic disease at the time of diagnosis of renal cell cancer derived a clinical benefit from nephrectomy, followed by systemic treatment in the majority of cases. All these trials were retrospective data and were highly impacted by unidentified biases inherent in these trials. So Camina tried to answer this question whether patients derive a clinical benefit according to an individual risk profile on a prospective basis.
Was the consensus that Camina changes everything?
Camina demonstrated that systemic treatment alone is superior to cytoreductive nephrectomy or a surgical approach when this patient population is addressed belonging to the poor risk group. But this is also a practice we have followed during the last year already. What's new is Camina demonstrated that we can lose the fear of subjecting patients to a systemic TKI-based therapy who subsequently undergo an interruption of this treatment due to an experience published by Tom Pauls that this might hamper the prognosis of the patients. Camina demonstrates that this is not the case. But the new is with Camina that for the intermediate risk group population, we need an individualized therapeutic approach that includes, on the one hand, metastasectomy, so resection of metastases, and on the other hand, for patients with a higher metastatic burden, systemic treatment upfront, nephrectomy perhaps.
Marqués, thank you so much for joining us.
Thank you very much.
EAU TV is brought to you from the 34th Annual EAU Congress in Barcelona. And if you'd like to watch more things like this, then you can click on these videos here. And you can also subscribe for the very best in medicine, from psychology to urology, from gynecology to genetics.